There's nothing like that moment sitting in your doctor's office when they tell you, this is a genetic illness, there's no cure, and this is something you're gonna have to manage the rest of your life. I'm Camille from Friday We're in Love, and I'm teaming up with my friends at Rogaine to talk about defying your DNA and making the most of your life even when you have genetics not on your side. I want to talk about blood sugar issues, insulin resistance, prediabetes, diabetic issues, and some of the things I've learned that have best managed my blood sugar throughout the phases of my life and helped me defy my DNA. Number one, I learned about food. I was controlling my diet for the first time ever. It's amazing when you actually stop to research how protein and sugar and fiber and everything interacts in your diet, what a difference can be made. If you're somebody who's eating your food without being aware of what's going into your body, you're going to want to learn to read those nutrition labels and start to make a list of things that work best for your body with the right levels and right balance of everything that it needs. This is a good thing to talk to your doctor or a nutritionist about. Number two was changing my portion and snacking habits. I'll never forget the first time I went to Europe, and I was amazed how small the portions seemed to be. But I came back a changed woman. I started eating smaller portions and realizing I handled food quite a bit better in smaller doses. I also realized that I was eating 3 large meals a day, and I wasn't really snacking all that much. When I was, it was usually a sugary treat at night. And so understanding how protein worked in my body and how frequently I needed it really changed my life. I remember a nutritionist telling me that even if I ate natural sugar like an apple, one of my favorite things to eat, that I should be adding peanut butter with it just so I had a little protein to balance out the sugar. At first, once again, that seemed a little overwhelming to change the way I was eating and how I was eating and how frequently I was eating. But it's amazing how it all came together for me in no time at all as I started noticing changes in how I felt. So understand how you're eating, what you're eating. If you need to track and keep a diet, keep a log of your diet for a while, do so. It'll really help you understand how to better portion out your food, how much protein you're eating, and when the best times of day are for you to feel the best. Number three is to exercise. I know that one may seem a little bit obvious, but I swear exercise changed my life. I began long distance running years ago, and I noticed that my blood sugar was always more stable, my mood was always better, my focus and clarity was better, and just life seemed a little bit better in general by running. I had doctors confirm later that that was one of the best things I could have done for my health. I know we don't always have a ton of time to fit in long distance runs or long exercise programs, but even a little bit every day makes a huge difference in helping stabilize blood sugar. And so if you can weight train and have more muscle mass to balance things out, if you can get some cardio in to burn off some of that sugar, all the better. And one of my big secrets, if I cannot fit in an exercise, I try to go for at least one little walk with my son or my husband. I try to make some of our quality time part of our date, something a little bit active so that I can help balance my blood sugar even better. Number four is seeing the right kind of doctor. This is a time when seeing a specialist can really make a huge difference. I'm really grateful for the primary care physicians that helped get everything started for me, but I'll forever be indebted to the endocrinologist that was able to really diagnose me and to really start me on the path I needed for change. If you know you have something specific, if you're dealing with a specific genetic illness, problem, you want to see a specialist that really knows what's going on. So make sure you're getting the right care and you're talking to somebody that really knows about what you're facing. And number five, see that person regularly. Maybe that is still your primary care physician. Maybe it is a specialist, but make sure you're going often. I've been amazed how weight change has changed what I need to do, how I need to exercise, medications I need to take, etc. It's really important that you get monitored regularly. When I was pregnant, I was diagnosed with gestational diabetes, and that was an all-time height of monitoring blood glucose levels. After I had a baby, I had some of the most stable best blood sugar I had ever had. Hormones are a crazy thing, as are genetics. So it's really important that as you change, as you age, as you lose weight, as you gain weight, as you have new life circumstances, new stressors, etc., all these things that can contribute, that you go see a doctor regularly and you get checked regularly to make sure everything's on track. And number 6, medication and supplements can make all the difference. I've had periods in my life where I needed to be on regular prescribed medication just to keep my blood sugar stable and my blood glucose as it should be. I've had times where I've had to use a blood glucose monitoring device. And I've also had times and seasons where I've been pretty good managing just food and exercise. It's really important that you, once again, see a doctor, back to number 5, but that you also understand that it's okay to take medications and it's okay to do supplements also. Certain supplements have really helped me. Sometimes the naturopathic way has been the way to go. But I think being open-minded to what your doctor has to say, to what may work for you, may make all the difference. It's amazing to me how 1 or 2 little tweaks in what I'm taking can change everything for me. This is a good place to add that if you're somebody experiencing hair loss or thinning hair, Rogaine may be something that makes all the difference for you. I'm clearly not a doctor and I don't know everything about these problems, but I am somebody who's lived a full, healthy life for the last decade with insulin issues and diabetic related problems. And I feel like a few changes, a few pieces of knowledge that I have, and a few things I've implemented in my life have made all the difference. And I hope by sharing them, I can help somebody else feel like they are also defying their DNA and living their best life.